Hi, my name is Peter and I'm a psychologist here at Sheffield Health and Social Care and currently the chair of the Black, Asian and Minority Ethnic Staff Network Group. Sorry I couldn't be there today, but just wanted to share a message to anyone who's interested in joining the Staff Network Group. So we are a growing group, quite large, and has been around since about 2012, if I remember that correctly. We have a change of chair every year, and the vice chair usually steps into the chair role, and the network group is quite active in the trust. We're very much involved or being drawn upon in terms of trying to look at policy, think about training, and also other sort of organisational development type issues, looking at ethnicity and that the differences sometimes in terms of people's experiences at work as a result of their ethnicity. So at the moment, one of the big things that some of the things we've done in the past, so out of the network group, we've got good links with the Build, Modify, Expand lead, who's the person who leads on mentoring for BME staff. And we've also got some links or doing things like training. There's been cultural training or looking at different cultures, so various people who have spoken to their experience for various teams. If someone's wanted to know about what things are like in a particular African culture, whether that's Ghanaian, Nigerian, or maybe something Bangladeshi or Pakistani, if there's teams that have been interested, we've been able to find members of the group, been able to do very short workshops for teams to understand a little bit more about those specific cultures. And at the moment, one of the things we're working on is the big conversation. And that's an opportunity to bring as many people in the organisation together as possible to talk about issues around difference, ethnicity, race, racism, and try and do something, or try and come up with some ideas of what the organisation can do to improve this experience or change this where it's a problem for people. So that's just a few things that we're involved in at the moment. We do also have socials. We've had less this year because of COVID. We just managed to sneak one in before the kind of lockdown, the hard lockdown started, which was very nice. And we'll look forward to more opportunities to come together, because the big function of the group is to be a supportive place for staff who are from ethnic minority backgrounds. One key thing to say is that we are not telling people whether they are black or not, or whether they should be included or not. If you consider yourself to be a minority ethnic group, that includes European or all those different countries as well, you are more than welcome to join. We do have people who are Polish in the group, and we've had people so white Polish, and we've had white German people in the group as well. So if you self-identify as a ethnic minority in the trust, you're welcome to join. That's it from me, and hope to hear from you soon. If you do want to get in touch, so my name is Peter Isebor. Otherwise, you can email the working together at shsc.nhs.uk email address. Okay, right. Hope you have a good session.